Morning, I'm going to talk to you today about moles. Many patients come to our clinic wanting mole checks. This is not surprising. These are concerned melanomas are pretty nasty cancers which can spread quite easily. So you really need to recognise a mole that might be suspicious and needs removal. The most important thing is to come and get it checked by a qualified person because it's really difficult. But a general rule is the A, B, C, D, E, F, G technique which we use. A stands for asymmetry, so a mole that's, if you took half of it and folded it over, wasn't the same on both sides. B stands for border. If the border is irregular, that's more suspicious. C stands for colour. If there's more than one colour or the colour changes within the mole as it grows, then that's a concern. D is for diameter, so a mole that's more than 7 millimetres might be more concern. E, we use elevated, so a mole that's raised might be of concern. F is for firmness, so a mole that when you pick it up it feels firm, that's really important. And G stands for growth, so a mole that's growing rapidly. If you've had a mole all your life, it's not changed, it's unlikely to be suspicious. One that's growing, perhaps half a millimetre every month or so, that's pretty suspicious. And those are the sorts of things I look for. The other thing I look for is something called the ugly duckling sign. A mole that looks different from the other moles that you have is of concern. So if you've got any of these things or you're concerned, then do come along for a mole check. We can look with our dermatoscope, we can remove those that look suspicious, and hopefully everything will be fine. So please do get in touch. Thank you very much indeed.